All right, everyone, Dr. Jack Wolfson here. I want to show you this recent case from a 54-year-old male. He's got a family history of coronary disease, mild coronary calcification on CT scan, and he doesn't take any pharmaceuticals, but he is nervous about his health, and he wants to see his health status. So I meet with him, and here's how we're going to perform. Eat well, live well, think well. And we're going to follow my methodologies of eat well, live well, think well. We had a nice discussion about these. And he got his before blood work, and he was very nervous after that. And he wanted to make some dramatic changes and then see how he would do. So really, we got the next set of blood work within under 2 months. So let's take a look at what we see right here. So you can see that his year of birth, 1969, and the date of the service of this test was 10/30. So this is very recent in 2023, just a couple weeks ago. And really comparing it to the data on the right, which is his testing as of September 7th. And we can see a dramatic reduction in his total cholesterol from 493 down to 342. LDL 384 down to 234. His ratios are much better, cholesterol to HDL ratio. Triglycerides are still high, so we definitely still have some room to work on this person, but we are clearly moving in the right direction in as quickly as 2 months. But there's more data I want you to take a look at that's very impressive, because the most important marker is not total cholesterol or LDLs or HDLs, it's ratios. So we can see here his ApoB, ApoA1 ratio dropped by over 30%. His ApoAs went up dramatically. His ApoBs went down dramatically. This is very, very, very exciting news and a tremendous reduction in his risk in under 2 months. In addition, and more importantly so, inflammation markers markedly improved. If you look at PLAC from 327 down to 199, that is phenomenal. And HSCRP, which is the most well-known and most studied marker of inflammation as it relates to cardiac issues, went from 1.7 down to 0.6. That is fantastic as well. Now, blood sugar takes a little bit more time to reduce on an A1C level because this is a 3-month measurement, but we're trending in the right direction. And I think when we retest him again, when he stays on the program in another few months, I think we're going to see that A1C well into the normal zone. My guess is probably about 5.2, 5.3. And uric acid. Uric acid is a risk factor for gout, but it's also highly correlated with cardiovascular disease risk. We went from 8.5 down to 6.1. And then another marker of inflammation called ESR, or the SED rate, went from 29 to 18. So this is all very exciting news as people follow our methodology at Natural Heart Doctor. Eat well, live well, think well, and then we test, don't guess at time 0. We test down the road, and we see how you do. And this person does embrace our Kickstart My Heart and our Wild Salmon Row. And those are the only 2 supplements that he is taking at this time, aside from some nighttime binders to bind up some of the environmental toxins, including potential mold exposure. So I hope that was valuable to you. We don't need pharmaceuticals. We need eat well, live well, think well. We need the methodologies at Natural Heart Doctor. We can help you. Just reach out to us and we'll show you how. Thank you.